first one you'll see here is the vaccine shipments. What you see right there is last week we ended up at 310,000. That was a pretty considerable jump, a jump of more than 100,000 vaccines from the week before. And so you can see that number reflected there. And then what we are expecting this week is the 292, almost 293. So relatively flat and stable last week to this week. And then, like I said, we suspect next week we may get a few more, but we will share that with you. But again, generally encouraging and heading in a good direction. Next, you'll see on our dashboard here, again, 2.6 million doses administered. We are 71.8, almost 72% of the way towards that initial goal of 75%, about halfway there on fully vaccinated, and so continuing to make good progress. Again, our case rate remains really good. Our percentage of positive here, you'll see on the next chart, that 14-day rolling average. We will give it one sec here. Yep, that purple bar there, again, dipping down a little bit the last few days, now at 1.6%. And again, there's going to be day-to-day fluctuations based on a variety of factors, but you can see the last few days, 155, 160, 129, 144, 136, lower than where we've been, and so our case rate could be descending. That is encouraging. We don't have as many tests that are being reported on the whole. It varies pretty significantly day to day. And a part of that is a lot of folks are using antigen tests, and those are not counted. These are only PCR tests, and so a lot of rapid tests are out there. So we think there's higher utilization of testing still happening, but what we count and report are PCR tests, and we will continue to make those available throughout San Diego County. And then the final chart here is just the one where you're seeing the rough case count. And again, you see us holding relatively flat and stable there, across the board for much of the last month. In the last few days, we have seen the numbers begin to decline, so we'll keep an eye on it and look at this as we move forward. That concludes my update.